God heals in every way that we can think of. Even what I think is natural biomedical healing, I'm able to do because God designed me with a brain to learn. Hi, I'm Dr. Jen Kang, and I have been a medical doctor and surgeon for the last almost 15 years. And I'm actually still quite passionate about the healthcare sphere. Over all of this time, I think I'm called to it, and I think that I've been called to it by a loving, good God. And I actually think He loves the healthcare sphere. I have a lot of hope for it. I believe God has a lot of hope for it. And I'm actually not naive or ignorant to what our systems are like. All over the world, healthcare systems seem like they're struggling and broken. And never has it been so clear to us that is the case since the pandemic. Now, all the world knows that our healthcare systems are broken. But I have a lot of hope. And I think that what is needed to restore healthcare systems and healthcare practice is in the heart of God, and that He actually has the clues and the secrets, and He wants to share them with us. I want to tell you the key parts of my story that actually will help you to understand how and why I've come to these very insane conclusions and why I have so much hope for the healthcare system. I'm a 40-something-year-old mother of 4. I'm the wife of a beautiful Korean man who's been my partner in crime, my courageous strength, and my best friend for the last 21 years. And I have been in practice in Northern California in Redding for the last 14 years. 10 of that I've been in private practice, learning the ins and outs of how to run a medical practice in a system that is often very challenging and frustrating. I practice as an obstetrician gynecologist, and that is someone who is both physician and surgeon, caring for women from their youngest ages all the way to the day that they pass away. And I have always considered this specialty to be very noble. I guess you have to, if you are going to be up at the wee hours of the morning, you actually have to be under some sort of delusion that this is a very noble calling. And I will say, actually, my sense of my nobility was put straight to me by my son when he was 4, and he actually clued me in on what he thought of my specialty. I was one evening in the middle of family time. I think we were in a board game, and I got a call. It was time for me to go to the hospital to deliver a baby. And so, as usual, I explained to them, okay, I'm going to go. Mom's going to go deliver a baby, and I'll be back. It'll just be a couple of hours. And he paused, and he just kind of stared at me for a minute. And then he finally asked me, Mom, do you have a factory for babies? And I couldn't figure out what he was asking me. Like, why, Judah? Why do you ask that? And he said finally, well, where do you get all these babies that you deliver to people's houses? And then I realized, wow, how noble. My son thinks I'm a glorified UPS driver. So despite my glorious specialty, I have managed to survive, and this specialty is quite grueling. I feel that my passion for medicine has only increased, and I want to explain to you why that is. I say this to my residents all the time. You're going to hear about Jesus when you're with me, because He's such a big part of my life. He's like my kids, so I hope you're not offended that I talk about my kids. Jesus is like that. He is part of my family. I've grown up with Him, and He's the reason I'm still passionate about what I do and why I keep going. And so please don't be offended, but this is who I am. I'm ready to bring my authentic self, and I'm giving you the space to bring that as well. I actually don't remember when it was that I met Jesus. I grew up in a Christian home where Jesus was such a part of our lives that I don't remember not knowing Him. And I don't ever remember not loving Him. And as I grew up and as I went through my medical training, the honest truth is I never found a reason to not love Him. Not good enough, not legitimate enough. The moment that I knew that I was going to be a doctor was when I was 5. And it was Christmas. And I vividly remember a particular gift. No one remembers now in my family who gave me this gift. I think no one wants to take the blame for it. but it was a Fisher-Price doctor set. And in that era, these were neon colored. The reflex hammer was neon yellow, and the stethoscope was bright teal blue, and that thermometer, big, clunky thing. Oh my goodness. I was thrilled out of my mind. And it was like I had this epiphany as a 5-year-old. This is what I'm going to do with my life. And I had to grab my little doctor kit and all my tools and stand up on the coffee table in the middle of the room. And I was like, everyone, listen, I have an announcement. I am going to be a doctor. And somehow in my little 5-year-old brain, I actually thought that everyone was going to applaud and be excited. And maybe in some families that would have been the case. But in my Christian home, where I grew up, that was maybe not the highest calling. I grew up as a pastor's kid, and to them, the highest calling probably would have been like a missionary, someone who just poured their whole life out to help others encounter Jesus and to understand the freedom and the love that we had discovered in Christ. And so they just kind of stared at me like, oh. And I remember that one of my parents said to me, or you could be a missionary. And I remember feeling a little deflated and confused because to my 5-year-old brain, they didn't seem different. And since then, I would say that I have come to learn that they're not. When I was about 8 years old, I was filled with the Holy Spirit. It was a normal part of my family's life. I always heard my parents walking around praying in tongues. And to me, that seemed quite normal. I remember a reality where the spiritual realm was a normal part of our lives. I remember church life where unusual miracles happened regularly. I would not have been able to be convinced that that wasn't real and that there wasn't a spiritual realm. I remember in particular miracles of healing happening. I remember my father praying for people in our church. There was a man who had a tumor on the side of his neck. And I remember my father praying for him and literally watching this tumor melt. And it was disgusting, actually, to be honest. And it kind of melted down the side of his neck. And we all celebrated that he'd been healed of this tumor. And that experience, of course, marked me. I couldn't be convinced that God wasn't present in daily life and that miracles were supposed to be normal. Of course, I also saw the other side of organized religion in Christianity, and that in the church there's conflict. And as a pastor's kid, I was not at all immune to seeing all the ugliest sides of how people could be. All these things, though, rather than making me feel jaded, they actually taught me that it wasn't religion that was going to be able to transform people. I could see how that was different than the encounter with Jesus. What was really needed to transform people and to heal them was an encounter with Jesus. Medical school happened. And I say that because medical school is grueling and rough. And as I entered that realm, I was confronted with belief systems that were completely different than my own. And I was confronted with this very biomedical approach to seeing the world, that everything could be explained by scientific particles and laws, and that there was nothing outside the physical realm to reach for. Now, I went to medical school at the University of Rochester, which pioneered innovative curriculum of teaching medicine in this context of what they called the biopsychosocial model. And I'm really grateful for it. It was this grand attempt to actually incorporate awareness of and value for the social and the psychological and emotional determinants of health. And that perspective was fantastic. And it was at the time innovative. Now it's becoming more integrated into all of our education. But I also noticed that there was great effort being made to teach us compassion and freedom. But there was something really significant missing, and that was the spiritual realm was not present in what we were being taught, and awareness of the spiritual realm and how our patients and our colleagues might value that or might be able to receive from that, or what possibilities might exist in that outside of the physical. That was just not present. This is the first time where I encountered that, in fact, those in the healthcare system are often kind of burnt out. There's compassion fatigue. There's frustration. Like, who knew? I had thought this was completely noble career. And I started to stir inside of myself, like, how do I bring what I grew up in, and how do I reconcile this with this biomedical model, which knows to some degree nothing of the spiritual realm that I've experienced? I struggled, and I started to have doubt and self-doubt, and I kind of withdrew my spiritual experience and kept it to myself. And that didn't feel normal. That did not feel comfortable to me. I wasn't actually myself. In residency, I, of course, stepped into an even more intense lifestyle. And I actually got incredibly depressed my first year of residency. Here I was as an OB resident working incredibly long hours, sometimes 80 to 100 hours a week. And I had just had my first child, who I hardly ever saw. And it just devastated my internal being. There was conflict inside of me. I saw my child so little, and there were so many people around me with so much need, and there was so much performance evaluation. I felt like I could never be myself, and I felt alone. And I remember the moment this shifted for me. I was actually on rotation in the ICU. Every intern had to do this, and we would be on rotation with a senior level resident, and at night, it would just be the two of us. They were actually pretty scary times because our attending would not be there, and the upper level resident often wanted to just sleep, and so would say to the intern, okay, you've got the floor, call me if you really need me, but don't call me for stupid things. And then you, as that first year intern who had a lot of book knowledge and almost no experience, is there taking care of a whole unit of incredibly critically ill patients. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media. And I remember that fear and panic inside of me stirred me to reach for what I knew was strength. And I found myself internally praying as I walked up and down the halls. And of course, what do you pray then? You pray, God, please don't let me kill any patients tonight. Please let's just get through the night and not make any massive mistakes. And you learn to ask your nurses, so what would a resident normally do for this patient? And you listen and you learn from your nurses, right? And I remember there was this one particular patient, a 40-something-year-old, young, otherwise healthy man who had been admitted to the ICU with acute, non-infectious interstitial pneumonia. This is an incredibly devastating disease. And he had rapidly progressed into respiratory failure, and he was on a ventilator at very intense settings. He was not doing well. The overall prognosis for him was grim. Our attending on rounds that particular day had talked to us about, we're probably looking at needing to speak with the family about withdrawing care. He does not appear to be improving, and we've run out of options. And I remember that night, I'm the intern. I'm there alone. And I started to just pray that I wouldn't kill this man tonight, that he would last at least to the next day. That's the basis of my faith at that point. And I had walked into his room to check on him, and there was his wife sitting at his bedside just weeping. And of course, it made sense. It'd been long haul, but my heart was moved, and I went to sit with her, and she looked up at me helplessly and said, I can't even pray now. I don't even know what to pray now. And something leapt inside of me and it burned. And I looked at her and said, well, would you like me to pray? And she said, yeah. And I remember sitting with her and praying, and the part of me that knew the power of Jesus and the possibility and of hope what he can do. That began to stir in me again. And it didn't go through my brain. I didn't like logic it out how this was going to work. I just prayed from my heart. And, we didn't have an eventful night. And the rest of the unit stayed alive. But in the morning, something began to shift for this patient. And to this day, nobody really knows what it was, but his respiratory function spontaneously began to improve. And the respiratory therapist and nurse who were working with him gradually were decreasing his vent settings and were puzzling about his function and his numbers, and his arterial blood gases were improving and his labs were improving. By the time that we were on rounds with our attending physician, he was so improved that the attending was astounded. And we actually ended up extubating this patient by the end of the day. He was so improved, and he was awake from sedation and was doing well. And I remember my attending said to me, "I can't explain this. I don't know what happened. He has defied all of the odds. Everything that I thought has not come to pass." Guys, sometimes we just see this. Sometimes in medicine, we just can't explain what happens. We don't know how the body can heal itself. And he proceeded to lecture us about all of the details of the unknown. But I knew what had happened. And I had suddenly had this moment where I realized that my spirituality and my connection with the power of the Holy Spirit, it belonged in medicine. And it belonged seamlessly in what I was doing. And it was wanted and it was needed. It reintroduced me to the overlap between the natural and the spiritual realities, that they aren't separate. It reassured me that my full authentic self, the part of me that loved science and medicine, and the part of me that loved Jesus, they were not incompatible. It began a discovery that has brought me to this moment. But I also needed to learn another couple of really important things about the role and the intention of God in healthcare. As I started my practice, I started practicing in the Indian Health Service in Navajo, a people group that I just came to fall in love with. I began to see more unexplainable healing in patients that I cared for. Sometimes it was gradual and not clear, and sometimes it was incredibly obvious and stark and amazing. I found that the Navajo people taught me so much about bringing the spiritual reality into healthcare, because for them, their spiritual awareness was so normal and part of their culture. They were so open-hearted to considering input from another realm. I did, however, realize at one point that I still thought that what I had learned to do in medicine and as a surgeon, it was good and it was useful and it was helpful, but I was always just a little bit disappointed when that was all that I did. I was much more excited when I prayed for somebody or I gave them some hope and I saw something that looked supernatural happen in their care or in their outcome. That to me was just so much more exciting. Of course, it felt more dramatic. But I still thought that there was like almost a grading system, that somehow natural and biomedical science was just a little bit inferior. And I will tell you, there was one encounter that actually completely shattered that paradigm. And it's a story I will tell over and over again from that day because it really did change me. And this happened when I was on call in the hospital at this Indian Health Service. And this was a very regional hospital that served a huge catchment area, but there were very few doctors, and we did our very best to give good health care with very limited resources. And I was on call. Usually there was just 2 surgeons on call on a given night. It'd be me, the OB, and a general surgeon. And I was actually in an operation with a general surgeon that night. It was in the middle of the night. I was assisting him on a case that had come in for emergency care. And the call from the emergency department came. And the emergency department doctor sounded actually really scared. on the phone. And he was like, listen, Dr. Kang, I need you to come up here now. We have a really sick lady here. And she's got an abscess in the genital area that looks really bad. And she's crumping fast. I need you to come. So I scrubbed out of the case. I ran up to the emergency room and I evaluated the patient. And my heart kind of sank. It was bad. She was only 22. She was otherwise healthy. And she had come in after several weeks of pain and redness and fever, not wanting to seek care because of the sensitive area of this infection. But she had deteriorated. And by the time I saw her, she had a large abscess that was gradually turning purple in front of our eyes. It was actually, the tissue was dying and necrosing. And her labs looked horrific. Her white blood cell count was over 40,000. She was febrile. Her blood pressure was low. She was really in dire straits. And as I looked at it as a young surgeon who had just gotten out of training, I felt worried. But in that moment, I felt this like lift of faith. I actually thought, well, you know what? I'll just pray. I actually think that God will just heal this. This will be, that's the solution. And I just felt this like confidence. Yeah, I'll pray. So I asked the family, would it be okay if I just pray before we keep going? And they were like, sure, absolutely. And so I prayed and I felt really good. Amen. And nothing happened. And in fact, she started getting worse and her mental status deteriorated. And the team around her began to become worried. We were actually going to lose her airway because she couldn't keep it open. She was not even aware enough to do that. So we actually had to intubate her. And at that point, I got on the phone with the university level tertiary care center to call for help and to talk to the surgeon specialties there, because at this point, this young woman is crumping so fast. She needs immediate surgical care, but it felt like this is way outside of my scope of experience and I need help. But they actually said to me, listen, what you're telling us, this patient does not have time to be flown here. You are going to have to take her to the operating room and do what you can. I don't know if you'll be able to save her, but you're certainly going to lose her if you transfer. And in that moment, all that faith, all that confidence in this God that I know can heal felt really, really confronted. And I just knew, okay, I'm going to have to try to do what I can. And I'm going to have to try to do it by myself because my surgeon assistant is actually in another case. He can't come help me. So we actually went quickly to the OR. We set up. I'm actually praying under my breath in tongues. I'm actually that worried, only because I'm trying to calm myself. Okay, I need you, Jesus. I need you to show me what to do. I need a miracle because I have not done this kind of a case by myself before, and I feel really worried. And I feel the weight of responsibility of this young woman's life. Like, I don't want to be the one that loses a 22-year-old in the first year of practice. And as I picked up my scalpel, I remember distinctly feeling a sudden sense that he was with me. I was not alone. And then I heard his voice within my spirit saying, there, cut there, now there, now there. And I literally was like, oh, wow. And what I felt like God was telling me to do in this surgery was cutting out sections of tissue beyond where I had thought this infection had extended. And when I did, I found it was there under the surface. There was already necrotic tissue. And so I kept cutting, and I felt this rhythm and this flow. It was like something I had not experienced before in the operating room. I was operating with somebody I could not see. And the skill level of his instruction was perfect. And I kept cutting and I kept cutting. And the tissue I was removing, the dead necrotic tissue from this necrotizing fasciitis, began to pile up on my scrub table. So much so that as I was looking at it and continuing to cut and continued to scrape and debride and remove, my heart began to grieve. Here's this young woman, and I was taking out a section of her most sensitive part of her body that was massive. The amount of resected tissue, and the amount of of recovery that I already was envisioning she would need. She would need a massive skin graft to close in this defect. And even then, the deformity that she would have, I could just feel this grief welling up in me. And I'm cutting and I'm cutting. I was distracted by my grief because all of a sudden I started to feel like something very odd was happening. And at first I couldn't quite put my finger on what it was. And I thought maybe this is the middle of the night. Maybe my eyes are blurry there was something happening. This wound, this giant wound that I was creating by removing all this infected tissue, it was changing. And it almost looked to me like it was moving or closing in. And the tissue that I was cutting and the defect that I was seeing, they didn't match. There was all this tissue on the table, and this defect almost seemed like it was contracting in. And the only way that I can really describe it, it looked like a wound that was granulating in. It was very subtle and was happening slowly. And I couldn't process that in that moment. My brain was not able to comprehend it. I just knew something was really strange. And finally, I just couldn't take it anymore. And I leaned back, I stepped back, and I just stared. I didn't know what to do. Should I say something? Thank God for my scrub tech. And he actually also had been seeing this, working very closely with me. And he said, "Well, Doc, I don't know. It just feels like what's on the table doesn't match that hole." I was like so relieved. I can't even describe how relieved I was because I thought I was the crazy one who was delusional, delirious, and imagining something. And we continued to watch that wound contract in and close in. And at that point, I checked in with my anesthesiologist. "Hey, how are we doing? How's she doing?" And he said, "It's odd. She's doing a lot better. I feel like you must have made progress. I've pulled off one of the pressors already. Her blood pressure is improving. Her parameters are improving. I think we're really getting there. Good job." And we really didn't do any more cutting at that point. I just started cleaning up awkwardly. And I asked my surgical tech to prepare some packing gauze and all the things I'm supposed to do in this moment. And meanwhile, this wound keeps contracting in. So we packed this wound. At this point, it had contracted down to probably a third of the size of the original resection area. And I was kind of shaken at this point. I still didn't have words for what had happened. We transferred her to the ICU. She did remarkably well. These patients are usually incredibly sick for a long time. Usually they remain intubated and on the edge for days. Usually we have to go back to the OR multiple times, sometimes more than once a day, to remove more of the additional infected tissue to keep that infection from spreading further. We didn't. We extubated her the next morning. She woke up. She was alert. She was fine. That wound kept contracting in. She discharged from the hospital 2 days later. It was absolutely insane. Everyone shook their heads about it. Nobody could quite grasp. Well, maybe she wasn't as sick as we thought. I don't know why it's healing so quickly. We never transferred her to the tertiary care center. I did her wound care in my clinic over the next 2 weeks. We're talking a giant resected area that contracted down, granulated in, and healed all on its own with wound care and no skin graft. And she had just a thin scar line at the end of 2 weeks. You can imagine that this shook me, rocked me, changed me. And one of the most important ways that it did is that it demonstrated to me that healing is actually a full spectrum endeavor, and that what God wants to do is to be present with us in it. He doesn't want to do his part and we do our part. And really, why do we think that we can separate the part that we do and the part that he does? Even as surgeons, we rely on the body to heal itself after we've stitched it up. But what is that mysterious thing that is happening? We can explain it biologically to some degree, but there's a degree to which we can't explain it. There's a design that is present in healing that comes from God. He's always been in healing. It's always been part of who he is. And for us to think that somehow we can separate the sacred and the secular of what we do, it's silly. What part did I do in this patient experiencing healing? Well, my scalpel, my hands, I did something active. But there was something else that happened that I did not do. And that was beyond normal capacity of our realm. It didn't follow the rules, the physical reality. I would say to you, I think that God heals in every way that we can think of. Even what I think is natural biomedical healing, I'm able to do because God designed me with a brain to learn. I am able to do surgery because God gave me the capacity for it, and the hand-eye coordination and the ability to see. All of this comes from him. Why do I think that's coming from me? And in our healthcare sphere, I believe all of the breakthrough and the innovation that we've been able to discover is only because he is present and he is with us, and he wants to be present and with us more. I think he wants to be more present in our activities of healing than we could have ever imagined. It still matters. It still matters that God is present in healthcare. It matters to our colleagues and it matters to our patients. We know that in the US, still the majority of people believe in God. They deserve to be able to find him in healthcare when they're in need. There doesn't need to be a divide between the natural and spiritual realities. They naturally coalesce and interface, and it's part of God's design to do that. If what I believe and what many of you believe is that Jesus has come to be with us, present, he hasn't left. He didn't come for a couple years, show us some good stuff, and head off for a couple thousand years for us to struggle and to be frustrated with a broken world. He is still with us by the Holy Spirit that can live within us. I know that I am not alone in this belief. I am not called to believe this and to bring this spiritual reality into healthcare by myself. There are so many healthcare heroes that I believe carry this same calling. Maybe you haven't realized it yet. Maybe you have, but like me, you don't quite know how to interface that. You don't know how to reconcile the two worlds that you exist in, that you function in. But I would love to challenge you that you have this incredible ability to bring both together, because when you have encountered Jesus, he is with you, and you bring him into the room every time you walk in to see a patient. That patient has the opportunity to encounter Jesus. And my passion is that more would be empowered to discover medicine is a holy calling. It is not less than. And the ability to bring something that has eternal value is massive. It lines up with the heart of God for our world. It really is time to expand our paradigms of what healing is, and healthcare needs us to get it. Hey, Healthcare Tribe, I hope that you've been impacted by what I've been able to bring through this podcast. I also want you to know about some opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahhealthinternational.org.